Go.
My name is Patience. My video recording today is based on a case study about a lung cancer. This is my patient. My patient name is John Brown. He came he came to the hospital today to see his provider, and then he was complaining about chest pain and then difficulty breathing. He also stated that he is a heavy smoker, and then his father died from lung cancer at a very young age. And also I was the attending nurse to this patient. Right away I began an assessment. My assessment information include I started assessing the patient level of consciousness. The patients were alert and oriented time 4. The patient was alert to person. The patient was alert to place. The patient was alert to time. The patient was alert to even to the date. My next assessment was I collected the patient's subjective data and objective data. My subjective data from the patient, which he stated that he was he was having difficulty breathing, and then he was complaining he had a chest pain. And then my objective data which showed that, and then he stated that he was a heavy smoker, and then he lost his father at a very young age. So my objective data, I observed the patient seemed very pale, and then the patient, when I took a vitals, the patient oxygen level decreased to 86. The patient's sputum showed like blood. He had a blood in his sputum. And then the doctor ordered a CT scan for this patient because all the symptoms and symptoms you were having. So then afterward, I called in the technician, and then asking about the patient CT result, and then the result showed 6 cm in diameter of tumor that already extended to the patient neck and chest wall. Also, the signs and symptoms for the lung cancer is chest pain, shortness of breath, weakness, coughing that does not go away, loss of appetite, unexplained weight loss, and even new upset of wheezing. My teaching for my patients based on his test that he received will include the treatment of surgery, chemotherapy, radiation. So, since it is a small cancer cell which can spread rapidly to the person's body, we will start with radiation or chemotherapy. For radiation, the side effect will be severe. The patient will experience severe fatigue, itching, or even peeling skin, sore throat. The patient's shoulder will be very stiff, or even difficult to swallow. The patient will be it will be very hard for the patient to swallow. And then for the next treatment, like chemotherapy, the side effect that regarding the treatment process will be hair loss, sore in the patient mouth. The patient will experience nausea and vomiting. The patient will experience diarrhea, and even loss of appetite or even weight loss, and then even mood changes. Since lung cancer as a whole, which is the most second deadly death rate in the U.S. alone, for my nurse note as a nurse, my note will include providing PRNP medication for the patient as the doctor prescribe it, because since the patient is in pain, in order to provide a comfort level for the patient, I have to administer pain medication for the patient to be comfortable. And then since the patient oxygen level is very low, it decreased, I will provide a supplementary oxygen via nasal canal for the patients. And then I will perform a routine of vital sign check. Like every time I will check the patient vital blood pressure, the heart rate, the oxygen, the everything. I have to check it and encourage the patient. Like some of the stuff I will do, I will encourage the patient to do some deep breathing exercise as well. Regarding the symptom and promoting the well-being of the patient, as a nurse, I will encourage the patient to get involved in a support group for cancer. Like I can even provide or educational materials, like go on the website like American Cancer Society, like find information about lung cancer, and then like help the patient to cope, provide a coping mechanism for the patient, encourage the patients to live a healthy lifestyle, such as encouraging the patient to avoid the use of saying he was a heavy smoker and then his father died. Right now, from his CT scan, which indicated the cancer. So now I will encourage the patient to avoid the use of any tobacco product, and then eliminate the use of alcohol as well. And now we encourage the patient to eat healthy, provide some nutritional menu for the patient that will help him live a better life. Be- Encourage the patient to get into some exercising, movement, and then coping mechanism, like to deal with his stress, because being diagnosed with cancer is very stressful and overwhelming for even the patient and the family. So as a nurse, I will be able to do that to help the patient cope with the disease, and then be able to provide medication, like encourage the patient to take his medication as it was prescribed, like encourage the patient to go for a routine screening and go for a checkup to see the level of the cancer, how it's infected to him, like whether it decreasing or it increasing. He have to do some routine checkup. It's not only going in just one day, but like going there doing some screening as well, going for lung cancer screening, as all that stuff like that is very effective for the patient. And then taking his medication as it was prescribed, not taking the medication today and not taking a medication tomorrow. You have to take it when the doctor say it. John Brown, you have to take your medication at 1 o'clock. You have to take your medication at 1 o'clock, and then you have to really eat healthy. Eat fruit with vegetable food that have protein. Eliminate high food that have high cholesterol, stuff like that. You have to get rid of every bad habit in order to live a healthy life, to live a healthy lifestyles. So he got to make that decision for himself. He as a patient, he got to think about himself. Oh, say, oh, I want to get well, so this is the step I need to take, and this is what I need to do in order to be able to help my family, because I know it's very stressful. So thank you. This is the end of my video. I appreciate everything. Thanks.